Good afternoon. Today we'll be seeing muscles of the back. We are from table 10. The first muscle is the trapezius muscle. The origin of trapezius muscle is from the external occipital protuberance, superior nuchal line, spines of C7 to T12 vertebrae, and the ligamental nuclei. The insertion of trapezius is the posterior border, lateral third of clavicle, the medial border of acromion, and the upper lip of crust of spine of scapula. The nerves supplied to the trapezius are spinal part of 11th cranial nerve, and the actions of trapezius muscles are the upper fibers helps in elevation of scapula, the middle fiber helps in retraction of scapula, and the lower fibers override adduction of arm. Now we will see the next muscle, that is latissimus dorsi. Now we will reflect the trapezius muscles medially. Now the muscles which you are seeing is the latissimus dorsi. The origin of latissimus dorsi is the iliac crust, the thoracolumbar fascia, the spines of T7 to T12 vertebrae, and the lower 3 to 4 ribs, and the inferior angle of scapula. The insertion of latissimus dorsi are the fibers twisted upside down around the lower border of teres major. The nerve supply present in latissimus dorsi are the thoracodorsal nerve from C6 to C8 cervical vertebrae. The actions of latissimus dorsi are it helps in swimming, climbing, pulling, adduction and extension, medial rotation of arm. Now the next muscle is levator scapulae. The origin of levator scapulae is the transverse process of C1 to C4 vertebrae. The insertion of levator scapulae is the medial border of scapula up to the root of spine. The nerve supplies of levator scapula are the dorsal scapular nerves, that is C3, C4 fibers. The actions of levator scapula are elevation of the scapula. The next metal is levator scapulae. The origin of levator scapulae is the transverse process of C1 to C4 vertebrae. The insertion of levator scapulae is the medial border of scapula up to the root of spine. The nerve supply of levator scapulae are the dorsal scapular nerves of C3 and C4 fibers. The actions of it are in elevation of scapula. The next muscle is rhomboid minor. The origin of rhomboid minor is the ligamental nuclei of spine of C7 and T1. The insertion of it is at the root of spine. The nerve supply of rhomboid minor are the dorsal scapular nerves. It helps in retraction of scapula. The next muscle is rhomboid major. The origin of it is from spines of T2 to T5, and its insertion is at the medial border of scapula below the root of spine. The nerve supply of it are the dorsal scapular nerves, that is the C5 nerves, and it helps in retraction of scapula. The next muscle is deltoid muscle. The origin of deltoid muscle is the anterior border of the lateral one-third of clavicle, and its middle fiber originates from the acromion process at the lower lip of crust of spine of scapula. The insertion of deltoid muscle is at the deltoid tuberosity of humerus. With the nerve supply of it are the axillary nerves. The actions of deltoid muscles are flexation and medial rotation of arm, abduction up to 90 degrees of the arm, and extension and lateral rotation of arm. Next muscle. The next muscle is supraspinatus. The origin of supraspinatus is at the supraspinous fossa, and it gets inserted into the greater tubercle. The nerve supply are the suprascapular nerves, and the actions of it helps in adduction of arm. The next nerve is infraspinatus. It originates from the infraspinous fossa and get inserted into the greater tubercle, and it also has the nerve supply from suprascapular nerves, and it helps in lateral rotation of arm. The next muscle is teres minor. The teres minor can be differentiated from infraspinatus by the fascia present in between them. The origin of teres minor is at the upper two-third of dorsal lateral border of scapula. and it gets inserted into the greater tubercle of humerus. The nerve supply of it are the axillary nerves from the cervical 5th and 6th vertebrae. It helps in lateral rotation of arm. The next muscle is teres major. It can be differentiated from teres minor by the head of brachii muscles present here. The origin of teres major is at the inferior one-third of dorsal aspect of lateral border of scapula. The insertion of it is at the medial lip of intertuberculus of humerus. The nerve supply of it are the lower subscapularis nerve of cervical 5th and 6th vertebrae. The actions of teres major are helping in adduction and medial rotation of arm.